Clearly, the healthcare industry is changing.
When you think about transformation and Medicaid being the large engine that it is, for example, in New York State representing a $68 billion portion of the budget, Medicaid had to look for ways to improve processes.
So we were very cognizant in all of our efforts that we had to harness the power of technology. We needed access to real-time information. And the only way that was going to be possible was if we had an electronic data warehouse underwriting the entire initiative that gave us the ability to mine that data and get it out to the field as quickly as possible and really empower people to make new and better decisions in a real-time fashion. And that's really where CMA excelled.
CMA has been active in Medicaid programs for over 20 years now. We've developed a strong focus in the company of developing Medicaid-focused enterprise data warehouse solutions. And over the years, we've worked with multiple clients. We've built more than 20 data warehouses and data marts specifically to support Medicaid analytics.
One of the things that we've done from the beginning is we've built infrastructures that will scale up into many, many, many terabytes and can adapt very quickly to change in the program.
We've stayed focused on building out flexible architectures that are capable of integrating with the contributions of a wide collection of partners that we have. Organizations such as 3M, Tableau, LexisNexis, who are capable of bringing their best-of-breed tools and capabilities on a just-in-time basis to address the nuanced requirements of our clientele.
We've never had a failure. We've always succeeded in what we built.
CMA is very excited about our Mosaic Insights platform. This is a product that we've not seen anywhere else in the market.
And that's a software infrastructure that allows individual users to plug into the grid. And when they plug into the grid, it's like they plug into an electricity grid. Well, this is a data grid. If you're off the grid, you're not access to the data. If you're on the grid, you've got access to all the data that's there. It's kind of like a shareable ecosystem where subscribers and publishers of data can interact on one platform with a governance layer that makes sure that it's credible data. So when we provision data, we register you as a subscriber. We know who you are. We know what data you can see. We know what you subscribe to. You'll only see that. And then we also know what queries you run. We know what your preferences are. So it's fun. You log onto the grid, you see your data, you can point, click, ship it down, run your analysis, and or you can publish it.
One of the great aspects is total flexibility for that end user analyst to access whatever tools they want. Many of our clients prefer Tableau for visualization, others want to use SAS, and the CMA platform has been built in such a way they can use any tools that they want.
That's a lot of what we've built is software that you can drop a lot of different commercial products on that are very specific in analytics, and our software runs complementary to them.
We're well on our way to reducing avoidable hospital use, the core measure of the initiative, by 25% over a 5-year period. And we've improved outcomes in a wide array of ways across the entire state.
We've actually built a repository now in New York State that covers over 20 million lives and over 20 years of historical data on claims and encounter.
We've got over 10 billion claims that we're managing right now, and we've got hundreds of billions of claims across all the different databases.
That's a very rich repository. And again, it's the type of data set that really allows for in-depth decisions and making major policy changes.
The initiative is now being looked at not only across the country but around the world as an inspiration for what healthcare systems should be like in the future. The key organizations that helped make the New York transformation possible was CMA. They really were the hub of the technology solutions that we used, and we used over and over again. Not only as the prime vendor who maintained the overall system, but as a very flexible contractor, bringing in subcontractors with specific knowledge and expertise to build a tremendous team that helped the state with its objectives.
CMA recognizes that Medicaid transformation is a long-term endeavor.
We work with our clients to build out highly customized solutions that are nuanced to address not only current requirements, but have the flexibility to respond to an evolving set of needs in the future.
Most of the contracts are 5 to 10-year contracts, and we want to make sure that there's a solution that meets all the technological requirements, meets the business requirements, and also can be enhanced, easily enhanced as we go forward.
We built, infrastructures 10, 15 years ago that are still running and still scaling. So it's about how you build that foundation so that You don't build it for tomorrow, you build it for 10 years from now. And we don't build it for where we are now, we build it for where we're going to be 10 years from now. So when we build something for you, you know that that is going to not only work for what you put in front of us, but it's going to work for something when you extend that and add more volume and more systems you want to plug into it.
This ensures that their investment is future-proofed and something that for years to come will help optimize quality and the costs of care.
Frankly, without CMA and all the work that they did to make that technology solution work for the state in our ever-evolving policy agenda, we would not have been successful.